peripheral arterial disease, or PAD, affects millions of adults, especially those over 70. It often leads to pain, limited mobility, and a significant reduction in quality of life. The PREPARE-IT trial is a groundbreaking study designed to evaluate how prehabilitation and rehabilitation, structured exercise, and risk management programs before and after surgery can improve outcomes for patients with PAD. This video will guide you through the study's design, its goals, and why this research could change the standard of care for PAD patients. Let's start by understanding the basics of PAD and why new approaches are needed. PAD is a common circulatory problem where narrowed arteries reduce blood flow to the limbs, most often the legs. This leads to symptoms like claudication, pain during walking, and can progress to more severe complications. PAD not only limits physical activity, but also increases the risk of cardiovascular events and premature death. Despite its prevalence, PAD is often underdiagnosed and undertreated, making research into better management strategies crucial for improving patient outcomes. Traditional treatments for PAD include medications, lifestyle changes, and surgical interventions like endovascular stenting. While these approaches can help, many patients continue to experience limited mobility and poor quality of life. Exercise-based rehabilitation is recommended, but referral rates remain low, and the combined effects of prehabilitation and rehabilitation have not been fully explored. This gap in care is what the PREPARE-IT trial aims to address. The PREPARE-IT trial is a randomized study involving 300 patients with symptomatic PAD scheduled for femoral popliteal endovascular stenting. The trial compares 3 groups: prehabilitation only, rehabilitation only, and a combination of both. The main goal is to determine which approach best improves walking ability, cardiovascular fitness, and overall quality of life. By carefully measuring outcomes at several time points, the study seeks to provide clear evidence for the most effective intervention. Rehabilitation refers to structured exercise and risk management before surgery. The idea is to optimize a patient's physical and metabolic health, making them better prepared for the stress of surgery. In PREPARE-IT, prehabilitation consists of 6 weeks of individualized exercise therapy, both supervised and home-based, focusing on improving walking performance and overall fitness. This proactive approach is expected to enhance surgical outcomes and speed up recovery. Rehabilitation in PAD typically begins after surgery, focusing on restoring function, improving mobility, and reducing the risk of complications. In the PREPARE-IT trial, rehabilitation starts about 2 weeks after the endovascular procedure and includes supervised and home-based exercise sessions. The goal is to help patients regain strength, increase walking distance, and improve their quality of life during the recovery period. Combining prehabilitation and rehabilitation could offer synergistic benefits. Patients who are fitter before surgery may recover faster and experience fewer complications. By continuing structured exercise after surgery, these gains can be maintained and even enhanced. The PREPARE-IT trial is the first to rigorously compare the effects of prehabilitation, rehabilitation, and their combination in PAD patients, aiming to set a new standard for care. The trial includes adults diagnosed with PAD who experience leg pain while walking and are scheduled for femoral popliteal stenting. Participants must be able to exercise safely. Exclusion criteria include unstable medical conditions, recent heart attacks, severe diabetes, or substance abuse. This careful selection ensures that the study results will be relevant and safe for the target population. The PREPARE-IT trial uses a range of objective and subjective measures to assess outcomes. These include time to claudication pain, peak oxygen uptake, VO2, 6-minute walk test, strength tests, endothelial function, and quality of life questionnaires. Measurements are taken at baseline, 6 weeks, 14 weeks, and 22 weeks to track both short and long-term effects of the interventions. Key measure in the trial is the time it takes for patients to develop claudication pain during exercise. This is a patient-centered outcome that directly impacts daily life and is highly responsive to therapeutic interventions. By comparing changes in this measure across the 3 groups, the trial aims to identify which intervention best delays the onset of pain and improves mobility. Secondary outcomes include peak VO2, which measures cardiovascular fitness, and various strength tests for both upper and lower body. These metrics provide a comprehensive picture of how the interventions affect overall physical capacity. Improvements in these areas are linked to better surgical outcomes and long-term health in PAD patients. Quality of life is a major concern for PAD patients. The trial uses validated questionnaires like the Walking Impairment Questionnaire and the Peripheral Artery Questionnaire to assess physical limitations, symptoms, and social function. These tools help capture the real-world impact of the interventions on patients, daily experiences, and psychological well-being. Participants are encouraged to perform daily home-based exercise, with progress monitored using the VASC Track smartphone app. This app tracks steps, distance, and energy expenditure, providing objective data on activity levels. Weekly reviews of activity logs help ensure compliance and allow for adjustments to the exercise prescription as needed. The Preparity trial blends supervised sessions at a rehabilitation facility with home-based exercise. Initial supervised sessions help patients learn proper techniques and safety measures, while ongoing home sessions promote independence and long-term adherence. This hybrid approach aims to maximize both safety and effectiveness. Understanding why some patients struggle with exercise is key to improving participation. The exercise benefits and barrier scale is used to identify perceived obstacles and motivators. By addressing these factors, the study hopes to optimize compliance and ensure that more patients can benefit from the interventions. To ensure reliable results, the study uses robust statistical methods. With 100 patients in each group, the trial is powered to detect meaningful differences in outcomes like time to claudication. Mixed effects models account for repeated measures, and intention-treat analysis ensures all participants are included, even if they drop out. Exercise interventions may benefit PAD patients through several mechanisms: improved collateral circulation, better endothelial function, reduced inflammation, and enhanced muscle metabolism. Fitter patients are better equipped to handle surgical stress and may experience fewer complications. Understanding these mechanisms helps explain why exercise is so effective in PAD. PAD is especially common among veterans who undergo peripheral interventions at much higher rates than the general population. The societal burden is immense, with healthcare costs for PAD exceeding those of many other chronic diseases. By improving outcomes and reducing complications, the Preparity trial could have a major impact on both individual patients and the healthcare system as a whole. Recent studies show that both prehabilitation and rehabilitation are highly cost-effective compared to surgery alone or usual care. By reducing complications, shortening hospital stays, and improving quality of life, these interventions can save money for patients and the healthcare system. The Preparity trial may provide the evidence needed to support broader adoption and insurance coverage for these programs. If the Prosperity trial demonstrates that combining prehabilitation and rehabilitation leads to better outcomes, it could influence clinical guidelines and standard care practices for PAD. This would mean more patients receiving comprehensive exercise-based interventions, leading to improved mobility, fewer complications, and better long-term health. In summary, the Prosperity trial is a landmark study that could reshape how we manage PAD. By rigorously comparing prehabilitation, rehabilitation, and their combination, the trial aims to identify the most effective strategy for improving patient outcomes. The results could lead to routine incorporation of exercise interventions before and after surgery, benefiting countless patients. As the population ages and PAD becomes more common, these findings will be increasingly important for both patients and healthcare providers.